Good day. I'm Dr. Joe Ebner, the Chief Medical Officer at Speare Memorial Hospital in Plymouth, New Hampshire. Today is a COVID-19 update intended for the town of Plymouth and the greater Plymouth community in central New Hampshire. Today's date is Friday, November 5th, 2021. Well, we have been at COVID now for over 18 months. We've learned a lot over this time, but still have unanswered questions. I know that you have access to national and international news sources, so this review today will really be a focus on what's going on locally, specifically in central New Hampshire. The state of New Hampshire, as well as the Hospital Association, follows daily New Hampshire trends with respect to COVID testing positives, as well as hospitalizations. Over the last 18 months, we have seen a seasonality for this illness in our state. As many of you recall, when much of the country was experiencing the initial wave of COVID in the late spring of 2020, we were largely spared from this initial wave, and then our numbers went very low during the summer months of 2020. We noticed our initial spike in December of 2020 through the spring of 2021. We then saw our decreasing numbers in the summer, and since September of 2021, we've again seen a spike of COVID-positive cases across the state. Similarly to the amount of COVID that's circulating in our communities, we've also seen a seasonality to those requiring hospitalization. Although our largest hospitalization in the state was in December through March of 2021, we dipped very low hospitalizations this summer, and since September, we've seen an increase again in hospitalized patients with COVID-19. Whereas our previous peak were around 330, 350 admitted patients across the state of New Hampshire, we are now in the 200 range across all the hospitals. With this new Delta wave, there was concern, especially in the American Southeast, that children may be predisposed to this new variant. I am happy to say that across our state, we are not seeing children hospitalized with COVID-19. I do check the hospitalized patients roster every day, and at most we have 2 children admitted to a hospital in the state. Often there are none. Although the current volume of hospitalized patients with COVID is less than it was last winter, Speare Hospital in Plymouth is experiencing our COVID moment now. What do I mean by that? Previously, we may have had 1 or 2 patients admitted at any given time to the hospital with COVID. We've now had, over the last month, almost every day, between 4 to 6 COVID patients. Although we have the capacity for this volume, it does place a strain on our local healthcare system. Our hospital has been exceptionally busy in the last month. Not all from COVID, obviously, but from other chronic illnesses, congestive heart failure, pneumonia, COPD, and sepsis, and the like. In fact, in my 23 years at Speare Hospital, I have never seen our numbers as high as they have been over the past month. I am very proud to say that our nursing staff, our technician staff, our therapist staff, everybody at the hospital is working very hard to keep our patients safe and well. We have, however, had days where we've had patients in the emergency room for 3, 4, or even 5 days waiting for a bed either at Speare or at another hospital around the state or around the region. I am happy to say that this past week, things have gotten better. There seem to be a little more beds open across the state, and we have more capacity in our hospital as well. Despite this increased volume of hospitalizations this fall, the state has not felt the need to open those alternate care sites, locally the Plymouth State Ice Arena. Those plans, however, do remain available and ready to deploy if needed. We do know that COVID is largely spread through infected respiratory droplets, through coughing or sneezing. Typically, it's in a closed environment with sustained close contact. What can you do to stay safe from COVID? Continue to wash your hands. Consider wearing a mask if you'll be indoors for a prolonged period or around large crowds. Probably the most important thing now to do is to get vaccinated if you have not yet received the COVID vaccine. This has significantly reduced the amount of severe illness, hospitalization, and death. Stay at home if you're sick and get tested. Just as a review, what are those COVID-19 symptoms? Those remain fever and chills, cough, shortness of breath or difficulty breathing, fatigue, muscle and body aches, headache, a loss of sense of taste or smell, sore throat, runny nose or congestion, nausea, vomiting, and diarrhea. Most importantly, if you have these symptoms, stay at home and get tested. On the screen is information about where you can get local COVID testing. Speare Memorial Hospital offers testing 7 days a week between 8 a.m. and 2 p.m. This is by appointment and is done through our website at www.spearehospital.com. This website remains up to date, and once you place your request, a staff member from the hospital will call you shortly to schedule that appointment. You can also get COVID testing at Midstate Health Center at their Plymouth campus. They offer testing Monday through Friday from 7:30 to noon. This is also by appointment, and for Midstate Health Center, call the number on your screen, 603-536-4000, option 8, to schedule that appointment. For those of you who may not be vaccinated, the vaccines now carry the full FDA approval for those 18 and older. Even those vaccines that were under emergency use authorization proved to be very highly effective against significant COVID illness or death. We do see some breakthrough, meaning infections in people who've been fully vaccinated. And I trust the science will continue to guide us, but at the current time, there are booster shots available. Where does New Hampshire stand? According to the Department of Health and Human Services, 60% of New Hampshire has received the first dose of the flu vaccine, or at least one dose. 55% are fully vaccinated. Grafton County does a little bit better with 62% vaccinated. Where can you get the vaccines? They're located at all of our local pharmacies. CVS, Rite Aid, Hannaford, and Walmart all offer vaccines against COVID. Also, new on the COVID front, on the COVID vaccine front, we now have emergency use authorization for children ages 5 to 17. This will be with the Pfizer vaccine, which is a 2-shot regimen, 3 weeks apart. It is similar to the initial Pfizer vaccine for adults, although it is at a lower dose. It is based on age and not weight, so any child between 5 and 17 now can get the Pfizer vaccine. At the bottom of the screen, you'll see a vaccine clinic coming soon to Plymouth Elementary School. This is in partnership with the Department of Health and Human Services. It is a mobile vaccine clinic that is coming on Monday, November 15th from 3:30 to 5:30. They're offering the Pfizer vaccine for those people older than 5 and older, and they offer the booster for that as well. Moderna is for 18 and older, and it offers a booster. And for the Johnson & Johnson, for people 18 and older, that vaccine will be available as well as a booster. No appointment is needed for that mobile clinic, and I hope you consider taking advantage of that. Speaking of booster shots, we now know that some people lose some of that immunity to the initial vaccine against COVID over time, and so boosters are now indicated. These are the same formulations as the initial shots. However, the Moderna vaccine is half the dose of the original. Who's eligible for the booster at the current time, anybody over the age of 65, any people ages 50 to 64 with underlying medical conditions, and anybody 18 and older who live in a long-term care setting should receive the vaccines if they're over 6 months since the second shot for Pfizer or Moderna, or if they're over 2 months after the shot if it was a Johnson & Johnson. You may get the same vaccine as the original vaccine or one of the others. In addition, the CDC says that for people 18 to 49 with underlying medical conditions, for people 18 to 64 who work in high-risk settings such as first responders, healthcare workers, teachers, grocery store workers, these people may get the vaccine. I suspect the vaccine booster. I suspect over time we will learn more about the requirements for booster, who is most to benefit from them, and how frequently we'll need to get those. So for those of you who have had the shots and are considering a booster, especially with the holidays coming up, it might be a good thing to consider. Speaking of holidays, I do encourage anybody who has not been vaccinated to get vaccinated and to encourage your loved ones. If you're not well, most importantly, stay at home and get tested. And until we talk again, stay well.